I'm Madden Cancino.
And I'm Anastasia Barley.
And this is our informational PowerPoint about abortion in the United States. First of all, a disclaimer, the information in this presentation is not from our common knowledge. A works cited page will be provided at the end of this presentation.
History of abortion in the United States. The topic of abortion in the United States has been a controversial conversation for a long time. Between the 1820s and the 1930s, laws criminalizing abortion gained traction. In 1973, Roe v. Wade legalized abortion across the country. However, this decision was later overturned on June 24, 2022. This ruling allowed individual states the right to regulate or ban abortion access instead of the decision being a federal responsibility. 41 states in the United States of America have abortion bans in effect, 12 of these states having a total abortion ban. The side of the argument that believes abortion should be legalized refer to themselves as pro-choice. The other side of this discussion, the people who believe abortion should not be legalized, refer to themselves as pro-life. In this presentation, we plan to analyze and describe the arguments of both sides of the discussion. Pro-choice, protection of the mother. One major argument for pro-choice believers is the protection of the person carrying the fetus. The death rate for legal abortions is 0.7 deaths for every 100,000 abortions. This makes abortions less fatal than colonoscopies, plastic surgeries, and 12.86 times less fatal than childbirth. Sociologist Amanda Stevenson explains how banning abortion accessibility can lead to more health issues, increased poverty, and less access to helpful resources. The World Health Organization also explains that, according to statistics, banning abortion doesn't actually decrease the number of abortions. Instead, it only decreases the number of safe abortions. This shows that reducing the legality of abortions doesn't decrease the number of abortions, but rather the safety rates, leading to more danger for people carrying a fetus. Pro-choice, access to abortions for medical purposes. Another reason pro-choice people defend their side is because of abortions being used in other medical situations, which means a ban could rob people of medical procedures they may need to live. For example, ectopic pregnancies occur when a fertilized egg implants somewhere other than the uterine cavity. This takes place in 1 out of 50 pregnancies, and they are unable to be delivered. These situations require the same medical procedure you receive when you decide to get an abortion. 1 out of 10 pregnancies result in a miscarriage, and the only medication recommended for an early miscarriage is the same used for medical abortions. For miscarriages that happen later in term or are more complicated, the same surgical procedure used for chosen abortions is recommended for those individuals. Overall, banning the ability to perform abortions on individuals takes away their right to the same procedure when it is medically necessary. Pro-choice, the right to decide on one's body. Another argument for pro-choice is about women having the right to make their own decisions for their own bodies. U.S. Treasury Secretary Janet Yellen stated eliminating the rights of women to make decisions about when and whether to have children would have very damaging effects on the economy and would set women back decades. In many cases, abortions are of teenage women, partially low income and often black, who aren't in a position to be able to care for children, have unexpected pregnancies, and it deprives them of the ability often to continue their education to later participate in the workforce. This shows how taking away abortion rights also takes away women's right to decide if or when to carry, birth, and raise a child. This makes those feel as though they are losing their rights to their body.
So now, for people who are pro-life, they believe that the unborn have a right to life. Pro-life individuals believe that all humans, including unborn babies, have a right to life, and it is argued that life begins at conception, and that is evident in the science. The first stage of human development, which is the zygote, is seen to have the potential to develop into a fully formed human being, and therefore it deserves the same legal and moral protections as all human beings. The science of embryology shows that the human embryo or fetus is a living member of the species, Homo sapiens at the earliest stages of development, and all human beings, regardless of their age, size, ability, and dependency, have human rights. And that's a quote from Paul Stark. Fetal heartbeat detection and the development of pain receptors indicate that the unborn somewhat experience life. They emphasize that an individual's worth should not be determined by whether she is wanted or not. In this view, people strongly defend the unborn who cannot defend themselves. Pro-life, negative effects of abortion on women. After getting an abortion, many women experience psychological and physical effects. From Nebraska Family Alliance, it says, women with a history of abortion are 81% more likely to encounter psychological health problems. Some examples of emotional trauma are regret, depression, anxiety attacks, drug abuse, sleep disorders, suicidal thoughts, and post-abortion syndrome, which is also called PAS. Around 20% of women suffer complications after abortion, and around 20.3% patients needed a post-abortion surgical procedure. Studies also show that increases the risk for breast cancer and subsequent miscarriages. Pro-life, moral and religious beliefs. To end a life is argued to be morally unjust and a violation of the principle that all human beings have the right to live. From a moral standpoint, supporters emphasize the need to protect the unborn. They believe that by allowing abortion, society will be seen as failing in their responsibility to defend the voiceless and uphold the principle of human dignity. Many religions, such as Christians, believe that life is sacred from the moment of conception. Passages in the Bible, such as, "For you created in my inmost being, you knit me together in my mother's womb," show the value of the unborn. Based on these verses, it is believed that God has a purpose for every human life before birth. How it affects the world today. So, abortion still remains a deeply impactful issue today. The 1973 Supreme Court case, Roe v. Wade, established a woman's right to choose abortion. This legalized abortion worldwide and recognized the protection of women's rights. But recently, in 2022, the U.S. Supreme Court overturned Roe v. Wade, ruling there is no federal constitutional right to abortion. This left the states to decide whether to regulate or ban abortion, and currently, 1 in 3 women now live in states where abortion is not accessible.
Conclusion. Overall, the debate of abortion rights and whether abortion should be legalized is a large debate in